Welcome back to Module 4 of the CHEG654 crash course. This video will cover autoimmune diseases, including why they happen, various types of autoimmune diseases, and different approaches to treatment. Autoimmune diseases are caused when the immune system is overreactive. There's a large imbalance of T effector cells to T regulator cells, favoring the T effector cells. Now, this is bad because T regulatory cells are needed to monitor the immune response and prevent the attack on healthy cells. So, when they're greatly outnumbered, you see that they're unable to properly monitor the immune response, and a lot of self antigens are causing these autoimmune disorders. Some of these include multiple sclerosis, in which inflammation is going to result in a deterioration of the myelin sheath, which is a protective covering around nerves. So, you see a loss of motor function there. Another one that is important to me, something that my sister suffers from, is celiac disease. So this is when T cells attack the small intestine when gluten is ingested. And finally, another one is type 1 diabetes. This occurs because pancreatic beta cells are seen as foreign, so they're attacked by B cells, which results in the inability to produce insulin. So I thought this is a pretty cool module because it really allowed me to make a personal connection to the topics discussed here, and I'm sure that it will allow you to personally connect to it as well. So some immunotherapy is focused on treating autoimmune disorders. They're really focused on either balancing the T cells or inducing tolerance. Because in healthy individuals, there are a lot of tolerance mechanisms present. One of the main ones is central tolerance, in which T or B cells that recognize self-antigens are swiftly killed, such that an autoimmune response is not present. But there's a lack of tolerance in affected individuals of these autoimmune disorders can really cause some problems. However, the autoimmune disorder, in all the cases, there's a large mechanism. So there's different places that can be pinpointed. So different approaches can be taken to fix the issues. Some of these methods include gene therapy, biologics against cytokines, therapeutic vaccines, artificial APCs, and CAR T cells. One that I wanted to talk about is therapeutic vaccines. So a therapeutic vaccine is intended to treat a disease rather than prevent it, which would be a prophylactic vaccine. And that makes sense for autoimmune disorders because they're often present at birth, but they don't present themselves for many years down the road. So producing a therapeutic vaccine involves the selection of a specific antigen and also identifying an effective delivery method. So an example that I wanted to highlight was the treatment of EAE, which is essentially a mouse model of multiple sclerosis. So MOG 35 to 55 is something that causes this disorder. And they use a modified version of mRNA, this M1-Cy modification, which decreases inflammation. So a decrease in inflammation is going to help because that inflammatory response that's usually seen in MS patients is what causes the continued autoimmune response. So we see injection with the MOG 35 to 55 M1-Cy mRNA results in both an increase in MOG-specific CD4 T cells and FOXP3 plus T cells. These are both forms of regulatory T cells. So that's great because we're boosting the numbers of Tregs, which is going to monitor the immune response and suppress autoimmune response. And finally, I'd like to talk about CAR T cell therapy. This stands for chimeric antigen receptor T cell therapy. And essentially, it involves retraining patients' T cells to suppress any cells that are causing the autoimmune response. However, there are some risks associated with it because you could oversuppress the immune system, and if a real antigen presents itself, like an external antigen, these patients might be at risk of being harmed by the disease because their their immune response is not acting properly. Additionally, it's difficult to design a universal treatment because there's different mechanisms seen across patients experiencing the same autoimmune disorder. So there really needs to be a personalized treatment designed for every patient. So it can be an expensive form of treatment. And I would like to add that this is early in development and clinical trial stages. So it's an interesting and exciting topic, and maybe many of you who might be taking the class will be learning a lot more about it. And that concludes the fourth module of this CHEG 654 crash course. I hope you enjoyed, and I hope that you are looking forward to enrolling in this class. Thank you.